getting getting it. Probably I can be like your first speaker and finish the talk quickly again. I'll do it for you. It can be. I know that, and like I just got, and I'm going to cut short as much as possible. So I'm not going to go into all the theories, and I think people sitting here, the learned geneticists know more than us, and the clinician know more in clinician side. So I just wanted to be a link. The reason is I like the word clinician scientist, and that's what I'm trying to do now. Genetics of, he's asked me to speak on macular dystrophy, RP, but I don't have any financial interest. And as Dr. Sharala mentioned, last day of RO, it was very it was. I think the people who were doing research and saw the result, and they brought the patient, and that was a boy and the father, and they brought to the stage. And I think the president of RO was so proud to keep the patient in front of the audience with the entire RO standing. And same thing happened in the Euretina Award. Was this again for the genetic work on retina? So I think there's lots to be done by the clinicians, that's ophthalmologists, and maybe the other medical person, because if you read the book, Arnold Sosby's book, with an ophthalmologist, written a book on, and he mentioned the playground for genetics is ophthalmology. And the eye has a pivotal role in evolution of human genomics. At least 90% of the genes in the human genome are expressed in one or more of the eyes, many tissues and cell types at some point during a person's life. And macular dystrophy, I'm not going into the detail, autosomal recessive, the Stargardt disease, and fundus flaviolatus. I'm just going to say, I'm not going into the details. I want to cut short time. And second, why I'm talking on this, and this is again a video from the internet. Thanks. Sorry. I just want to show the. Thanks to Dr. Kumar who gave me the video, which is about the usefulness of the sound cable. Oh, that's okay. I'll put the microphone.
For sufferers of hereditary blindness, there may be a light at the end of the tunnel. 2 experimental trials have shown that gene therapy could one day cure a rare form of blindness that affects about 2,000 Americans. The research teams tested the treatment on a total of 6 patients. Here you can see how they performed the eye surgery. Repair genes were injected into the eye of this young visually impaired patient. The eye was infused with air, then reinfused with fluid near the end of the surgery. To measure the patient's performance before and after the treatment, he was guided through an obstacle course. Here you can see how he navigated through the maze prior to the surgery. He bumped into obstacles 6 times and was disoriented twice. It took him 77 seconds to finish the course. 6 months after the treatment, the patient showed a dramatic improvement. He was able to make his way through the maze in 14 seconds without bumping into anything or getting disoriented. He was one of 4 patients that showed an improvement. The treatment also proved to be safe, which has not been the case with previous gene therapy trials.
So the reason I'm interested in genetics and in ophthalmology is there a lot of work to be done, and when something comes through, I'm happy. Most of the retina disease, the retina surgeon, we have to do that, and we work on the subretinal space. And I think what I wanted to say, quote Dr. Charles Keepens, that never say never again to the patient, because this was a standard statement for the patients who were asking, particularly RP or any of the people who are going blind or blind. And he told the patients that never again to the patient. The reason is what was not possible the last 50 years back we can do today, and what is not possible today maybe in our lifetime we can do. And I hope, because already clinical trials are going on in the MOVE field, and on this particularly the presentation what you saw, as well as the subretinal surgery which is being done as an injection into the subretinal space. And that's why as a surgeon also it feeds me to keep doing something new, and technology wise we are with it. So I'm actually thank Gerald for giving me the time, and I'm not talking on the genetics of diabetic retinopathy because we don't still have anything. I have only theory with me here, even though Dr. Kumar, who's our director of research, we are working on, and we also have, I'll probably show the last few slides because I'm not going to talk that. I want to give time to the next session because even though the previous morning section they took time, they have delayed. So I want to show the conclusion slide. The widespread application of linkage analysis and mutation detection techniques has helped. Complex underlying pathology has now been revealed. You may listen to proteomics, and improved knowledge of the mechanisms of the underlying molecular genetics has raised the potential for future development of a rational therapeutic regimen. I think all of us sitting here are interested finally for the patient. And also it has helped to refine diagnosis, disease classification, and prognosis, and improved genetic counseling. And this is what we have formed with the help of Dr. John Prakash, Dr. Kumar, Dr. Takeshi, and others who are here with Mr. Sundaresan. We have a thing called Asian Eye Genetics Consortium, and in the, I think, Hall L on 7th, we have a session, and all are welcome. And this is our Silver Jubilee year. We are also celebrating with our hospital, the St. Erik's Hospital in Sweden, and SNEC. Thank you. Thank you, Jerry.